Okay, this video is called Do Cell Phones Cause Blood Clots? And really probably a more appropriate name of it is Do Cell Phones Increase Sympathetic Autonomic Nervous System Activation? But that was too long to put into a video title. So here's an article by Magda Havas. She's a famous researcher of EMF, electromotive force. And in this paper, she described cell phones. They cause clumping of the red blood cells. That's rouleaux formation. Rouleaux means stack of coins in French. They also increase the risk of heart palpitations. And what you're seeing happen here is there's upregulation of the sympathetic nervous system. So you have what is called an autonomic nervous system, and it has two main phases. There's sympathetic, and usually that's abbreviated SANS, S-A-N-S, for sympathetic autonomic nervous system. And you have PANS, parasympathetic, and that's abbreviated PANS, parasympathetic autonomic nervous system. Basically, SANS, sympathetic, is fight or flight. And that elevates the characteristic hormones of cortisol to increase your blood sugar, so you got energy to run from being chased by a tiger in the dark. And it also increases your catecholamines that increase your blood pressure. So when you vasodilate your muscles that are in use, you can generate more cardiac pumping pressure to perfuse those muscles so you can run and climb a tree or do whatever you have to do. Okay, but you don't want to be in the sympathetic mode when you're just hanging around on a casual day, because it means your blood pressure is going to be higher, your heart's going to be beating at a faster rate. Sympathetic activation also causes activation of your platelets. It increases the amount of clotting factors in your blood. The idea is, the way to remember everything is being chased by a tiger in the dark. The tiger might scratch you. If you bleed, you want the bleeding to stop. So your blood is slightly pro-thrombotic when you're stressed out. So the point of this is, this article shows that the effect of electromotive force is very similar to the stress response. It's certainly a mild form of stress, and we don't even notice it when it's mild by ourselves. We're not conscious of it, but there's a mild pro-thrombotic effect. And I show you this picture of this person putting a cell phone in their front pocket right above their heart. I can tell you, I am friends with some really good cardiologists, guys that are AOAs. AOA means Alpha Omega Alpha Society. Those are the top 10% of the medical students in a class. So this guy's an AOA, he's a textbook author, he's a smart guy, and he's a real nice guy. He carries a cell phone in his front pocket, so I make fun of him for being a dumb shit, okay? And what I'm trying to say, after I explained to him, then he stopped doing it. But you get the point that even the cardiologists don't know this. So it's a mild effect. But, a person who carries their cell phone in their front pocket for decades, they have an increased risk, if it's a woman, of breast cancer. You carry it down in your crotch, increased risk of injury to your testicles. And then if you carry it right in your back butt pocket, I wonder, you could sit on it, but I also worry, would that maybe increase your risk of rectal cancer it's a low power microwave transmitter. Okay, it's been shown around the head that it opens up voltage-gated calcium channels, so it has a mild stimulant effect. So it's a brain excitotoxin. And it also is pro-thrombotic. It activates the sympathetic nervous system, so it's a mild stress equivalent. And you get it from multiple sources. Of course, we always talk about cell phones, and you shouldn't hold a cell phone next to your head when you talk with it. You should use a speakerphone instead. But there's also cell phone towers, proximity to cell phone towers. There's also Wi-Fi. There's also smart meters, and each one of these things is very minimal by itself, but they contribute to all the other things that are adding up to have a sympathetic activation effect upon your body, okay? And then also to have opening of your voltage-gated calcium channels in your brain, meaning a stimulant effect on your brain, an excitotoxin effect on your brain. I'm just going to show you one more paper. Here's another paper, electromagnetic fields, do they pose a cardiovascular risk? So increased EMF, affect electromotive force, with increased SANS, sympathetic autonomic nervous system activation. So here they show it that parasympathetic is reduced. Sympathetically mediated heart rate variability is significantly elevated. You get a sympathetic effect. Our results revealed a shift in cardiac autonomic regulation towards sympathetic overactivity. Okay, and this is a group of young, healthy volunteers. Okay, parasympathetic underactivity. So it's activating your sympathetic nervous system. You don't want that. That means it's mimicking stress.